There we go. Beautiful. All right. So basically, I think what we're gonna do is just start with your story, the background to give people watching some sort of a sense of what you've been through. So you can kind of take it in your at your own speed and just kind of give everybody an idea of what you were suffering through before you saw me and how you're doing now.
Yeah, that sounds great. So I was an ultra marathon runner. I put in lots of miles on pavement, particularly. And my first ultra marathon was in 2016, and I was wearing some shoes that I think may have been a little bit too narrow for my. That's when I started feeling the first sensation of maybe my sock rolling up in my shoe or stepping on a pebble. Uh, Progressively, that got worse over the years uh, through running and just walking. I had multiple cortisone shots in my foot, um, 4 or 5 over the course of, probably the last 9 years, which the first 2 did provide some temporary relief, but the last 2 really didn't do anything. Um, I got married last May of 2024, and we went on our honeymoon in Hawaii, and prior to that honeymoon, my foot really flared up, and I had an extremely just sharp pain where it was really debilitating, and I just had a hard time walking. Uh, like I said, it was debilitating and just depressing. I didn't want to get up and do anything, and so I became absolutely desperate for some sort of intervention. And the last thing that I wanted to do was to have the nerve cut out just for the risk of subneuroma and just other horror stories that I heard online. So I'd found other places around the country that provide cryoablation and surgery. Uh, but what I needed was a one-stop shop. The other places around the country that do provide the cryoablation plus the decompression. Oftentimes they go in with a probe and they can't guarantee it on the first time. So that's when I was able to find Feet for Life and come down for just a weekend and get that taken care of.
So yeah, just to be clear, what you're describing is there's certain cryo centers that do cryo work where they're just doing a very small incision to place the probe. And they're going by studies that demonstrate that most people get about 2 years worth of relief. And there is really no attempt at decompressing the deep transverse metatarsal ligament. So essentially they're going for just freezing of the nerve. And so that's, just to make it clear for everybody listening. So you definitely didn't want that. And you came in. So what were the conditions that got you to the point where you finally said, okay, this is killing me? And how long, being an ultramarathon runner, did you live with the pain? Because your pain threshold must have been, on a different level compared to most people.
Yeah, that's a great question. It was I had just tried so many different things from 2017 up until 2025 when I had the surgery done, from toe spacers to the met pads just to get any sort of temporary relief. It was painful, uh, but when I was moving my wife from her apartment to my home, where it is now, that's where it just got inflamed so bad to where it was just getting. I couldn't walk around the house. It was becoming mentally just difficult to get up and do simple chores. So I would say the pain I dealt with was maybe a 4 or 5 for several years. But the 6 months prior to me having the cryo was, I mean, 8 and 9 on a lot of days. I couldn't wear. I had a hard time wearing shoes, and I was always looking for, flip flops or just any sort of. Oh, and I also tried. I tried laser treatments, MLS laser treatments to no avail. That was just out of pocket money that just I would never see again. Uh, so Yeah, I would say like 6 months up until till the surgery was when I was really starting to suffer. I became desperate at that point.
Okay. Let's fast forward to the trip that you took to St. Louis,
Yep.
getting you diagnosed. Let people know from your perspective how that went.
So the office I feel like is ran like just a very well-oiled machine. I came in on a Friday, or no, it was a Thursday for the consultation just to meet with you. I had X-rays performed, and you came in. We briefly met, discussed the condition that I was suffering with, and what I could expect from the surgery. Uh, Performed a Moeller's quick test, and I showed a positive sign for that. And uh, basically, just you gave me an idea of what to expect for the next day, which would be surgery. That was on a Friday. So we went to the office and uh, had that taken care of. And that was just a quick in and out procedure. Um, Went home later that evening and just babied it as best as possible. And the following day came in and uh, just checked with you to make sure everything was looked all right.
Okay.
Very simple.
And then, of course, we did the surgery. We did a decompression of the nerve, freezing of the nerve, injection of the nerve, which a lot of people don't understand is something that you can really do successfully. And then we used platelet-rich plasma
Right.
to essentially help the skin. That's one of the things that people don't realize when they hear about PRP, how good it is for the healing of the skin. So now let's fast forward your post-op. Obviously, you made it home. What was your course like? This is the important information here I want people to hear. Being a runner, wanting to get back, being athletic. Tell people what you went through at this point.
Yeah. So the healing process did not go as quickly as I would have preferred it. I think possibly just due to the amount that I sit and had just was not able to elevate my feet much and move around. So the healing of my foot did not go as quickly as possible, but just due to uh, where the incision was located, it was just a little bit of a slower healing. Um, However, once that did heal up, I would say, I don't know, it was probably about, I'm 6.5 months out now. And so now I'm running with no pain in my right foot, with where the neuroma was. I do still feel a little bit of numbness and tingling in my toe, the fourth toe where the metatarsal, where the neuroma was. Um, but that can be massaged out and I can walk around a little bit. And that feels better by the end of the day. Uh, but I still feel like I'm stepping on the nerve a little bit. However, once I get moving around, it starts feeling better. And I don't know how much of that sensation may go away over time. I've heard that it does with time it goes away, but I'm just taking it day by day. But as far as the stabbing pain goes, the pain's gone.
So yeah, that's a great testimonial because it's real. Because we're not holding back. We're not in white coats trying to gloss things over. As you know, it's really important for me to get patients to understand the course of the surgery, and I get a lot of people asking about whether or not I can pull out a crystal ball and tell them the future. And the perfect answer is watch these videos because most people that are like you, and I do have this Dr. Marty who is a great patient of mine, also a marathon runner. He's running now. These people are active, a lot of them. I think I mentioned to you, I had an ice waterfall climber last year. And it's common to have this marble-like sensation on the bottom of the foot. It could come from just the surgery, or the probe or whatever it comes from. It's a strange feeling, but it's not painful. And everybody that has the surgery agrees that it's well worth it. But I want people to expect that there will be a little sensation on the bottom of their foot. In terms of the numbness, that's normal. You had a nerve, it's still there, it's going to cause some numbness. And the most important thing is how did you feel about knowing you can trust me to leave the nerve intact and to not cut the nerve out?
I mean, that was the biggest part of this. This is the reason I chose this type of procedure is just, if all else was to fail, I had nothing to lose. The nerve was still there and I didn't have to worry about a stump neuroma. So, uh, like I said, I just feel like I had nothing to lose in, uh, proceeding in this type of operation.
Did I have you on Spruce or text messaging at all or any secure messaging when I did
Not,
the surgery? Okay.
not that I'm aware of now.
Okay. So, usually what I do is I either respond to patients via email if they have questions, or I now get them logged into a Spruce account, and then they can text me in
Sure.
just about real time. Let people know your feeling about our availability in terms of Feet for Life. Were your questions answered? Obviously, your expectations are being met. You are running, and you are running with a neuroma in your foot that's been treated to the point where it is now tolerable to run without cutting the nerve out. How has the experience been? And what are you looking for in the future? And are you going to do an marathon soon?
So I think that, uh, I think Speak for Life has been very, responsive. That's one way I would describe it. Your availability has been, um, it's been good because I feel like, when I have reached out to you via email, I've gotten quick responses back, and you answer the questions that I have in regards to my recovery. The nurses were wonderful. The staff was fantastic there. They took good care of me. And I called in a few weeks ago just to pay one of my bills off, and I'm like, hey, maybe you can transfer me over to one of the nurses. I spoke with Brooke, and she was fantastic, and she was able to just answer any questions I had satisfactorily. So it's been good. As far as running goes, not looking for an ultra marathon immediately. Just still trying to uh build up a little bit of stamina with regards to running and moving around. I'm dealing with a few other things as well. So I'm hoping by Labor Day, I'm signed up for a 4 mile race. So I'm hoping by then I can finish the race with no pain. So, and I fully expect to. So it's
Nice.
very good.
Well, I mean, obviously, you're a good candidate. You had a single neuroma. It's always great to high five the patient the day of the pre-op consult and say to the patient, "We know you're going to, that everything's going to go fluently here because we're not questioning whether you have a neuroma, whether or not it's prototypical. We can feel that molar sign." I want to just end or close by saying thanks for this interview. I think it
Yep.
helps people to see real people who've had this done. I do know that there are patients that are scheduling now all the time, and I'm hoping that they can see these videos and it helps them. And I'm hoping to hear from you in the next 6 months or maybe in a year and hear that you're really, really cruising on it. It makes me feel great to know that I got an athlete back to the point where he or she needs to be. So that's great.
Yeah, absolutely. Yeah, there. I hope this can help other people find an alternative because, and I need to put my testimony out everywhere I can online because I know when I was searching for an answer, it was very limited, and a lot of people went the route of neurectomy, and I just knew that that's not what I was looking for. I was just looking for something that would be less invasive, and we didn't have to cut out the nerve. And for me personally, it was somewhat local. I was able to drive down and meet with you. And again, just the accessibility of you and your team is it's been wonderful. It's been good. I can reach out to you whenever I have questions. So that's a bonus on top of that as well.
Well, thank you so much. Many of the people on my team have been with me over 20 years.
Yeah.
So Tom, thank you so much. I appreciate you taking the time. Look forward to talking to you
Yep.
soon. Deeply appreciate what you're doing. Keep going. And of course, feel free to email me at any time.
Sounds great, Dr. Woolwitz. Thank you.
All right.
All right.
Hey, thank you. Really appreciate this. I'll give you a copy of it.
Okay. Sounds great. Thank you.
All right. Take
All
care.
right. We're